The world is at a crossroads. A silent threat looms, jeopardizing decades of medical advancements. This threat is antimicrobial resistance. It is a global health emergency that demands immediate attention. The World Health Organization has issued an urgent call to action. At the 79th United Nations General Assembly, world leaders gathered to address this critical issue. The message was clear: we must act now to combat antimicrobial resistance. UNGA 79 provided a platform for global collaboration. It was a chance for nations to unite against a common enemy. The WHO's call to action resonated deeply with world leaders, emphasizing the urgency of the situation. The time for complacency is over. The world is watching, and the time for action is now. The consequences of inaction are dire. A recent Lancet study paints a grim picture of the future. If left unchecked, antimicrobial resistance could claim the lives of millions in the coming decades. Imagine a world without effective antibiotics. Surgeries would become risky. Simple infections could turn deadly. This is the stark reality we face if antimicrobial resistance continues to spread. The statistics are alarming. The study predicts nearly 39 million deaths from antibiotic resistance in the next 25 years. This is a global crisis that demands a global response. We must act swiftly and decisively. The future of healthcare hangs in the balance. Antimicrobial resistance knows no borders. It is a global threat that requires a global solution. International collaboration is not just an option, it is a necessity. We must work together to share information and coordinate research efforts. Sharing best practices and developing new treatments is crucial. No single country can tackle this challenge alone. UNGA 79 provided a vital platform for fostering global cooperation. It brought together nations from all corners of the world. Together, we can pool our resources and expertise to combat antimicrobial resistance. The fight against antimicrobial resistance requires a united front. Only through collaboration can we hope to overcome this global health threat. The second high-level meeting on antimicrobial resistance took center stage at UNGA 79. This pivotal event brought together world leaders, health experts, and key stakeholders. The goal was clear: to accelerate global action against antimicrobial resistance. Time is of the essence. The meeting served as a reminder that we are in a race against time. The spread of antimicrobial resistance is outpacing the development of new treatments. Discussions focused on key strategies, including strengthening surveillance systems, developing new antibiotics, and promoting responsible antibiotic use. The meeting highlighted the need for a multi-sectoral approach. The high-level meeting injected a sense of urgency into the fight against antimicrobial resistance. It was a call to action for all nations to prioritize this critical issue. Section 5. The Crumbling Foundation, AMR's Threat to Medical Progress. Antimicrobial resistance threatens to unravel a century of medical progress. Antibiotics, once hailed as miracle drugs, are losing their effectiveness. This has profound implications for healthcare as we know it. Routine surgeries and medical procedures could become increasingly dangerous. Organ transplants and cancer treatments rely on effective antibiotics. AMR puts these life-saving interventions at risk. The threat extends beyond hospitals and clinics. AMR also has a significant impact on animal health and agriculture. The widespread use of antibiotics in livestock is a contributing factor to the emergence of resistant bacteria. AMR has the potential to undo decades of medical advancements. It is a stark reminder that the progress we have made is not irreversible. Section 6. A Setback for Humanity, AMR, and the Sustainable Development Goals. The Sustainable Development Goals, or SDGs, represent a shared vision for a better future. They encompass a broad range of interconnected goals, including good health and well-being for all. AMR poses a significant threat to the achievement of the SDGs. It has the potential to undermine progress in areas such as poverty reduction, education, and economic growth. Access to quality healthcare is essential for sustainable development. AMR threatens to widen health inequalities and exacerbate poverty. It is a global challenge with far-reaching consequences. Addressing AMR is not just a health issue, it is a development issue. We must work together to ensure that AMR does not derail our efforts to create a more sustainable and equitable world. Section 7. A Call for Collaboration. The importance of a multi-stakeholder approach. Combating antimicrobial resistance requires a collaborative effort. No single entity possesses all the answers. We need a multi-stakeholder approach that brings together governments, international organizations, healthcare professionals, researchers, and the public. The preparatory multi-stakeholder hearing on AMR, held in the lead-up to UNGA 79, highlighted the importance of collaboration. Participants emphasized the need for a One Health approach, recognizing the interconnectedness of human, animal, and environmental health. Addressing AMR is not just the responsibility of governments or healthcare providers. It is a shared responsibility that requires the active participation of all stakeholders. By working together, we can leverage our collective knowledge, expertise, and resources to effectively combat AMR. Section 8. One World, One Health addressing AMR through a holistic lens. The One Health approach recognizes the interconnectedness of human, animal, and environmental health. AMR is a prime example of a health threat that transcends these boundaries. The use of antibiotics in agriculture contributes to the emergence of resistant bacteria that can spread to humans. Similarly, the misuse and overuse of antibiotics in human healthcare can lead to the development of resistant bacteria in animals. The One Health approach emphasizes the need for a coordinated and integrated response to AMR. This includes promoting responsible antibiotic use in all sectors, improving sanitation and hygiene practices, and strengthening surveillance systems. By addressing AMR through a One Health lens, we can effectively tackle this complex challenge at its source. Section 9. Leading the Charge. The Global Leaders Group's call for urgent measures. The Global Leaders Group on Antimicrobial Resistance has been a vocal advocate for action against AMR. This group of world leaders and experts has played a crucial role in raising awareness and mobilizing political will. In the lead-up to UNGA 79, the Global Leaders Group issued a powerful call to action. They urged UN member states to prioritize AMR as a global health security threat and to take concrete steps to address it. The group outlined a set of key actions, including strengthening surveillance systems, investing in research and development, and promoting responsible antibiotic use. They called for increased funding and resources to support these efforts, particularly in low- and middle-income countries. The Global Leaders Group's unwavering commitment has been instrumental in driving the global response to AMR. Their leadership has helped to galvanize international action. Section 10. Time for Action Translating Words into Deeds at UNGA 79. UNGA 79 provided a platform for world leaders to translate words into deeds. The international community came together to discuss concrete actions to combat AMR. Commitments were made to strengthen surveillance systems, improve antibiotic stewardship, and invest in research and development. The need for equitable access to antibiotics and diagnostics was also emphasized. UNGA 79 marked a turning point in the fight against AMR. It was a moment where the world acknowledged the severity of the threat and pledged to take action. The challenge now is to ensure that these commitments are translated into meaningful and sustainable action. Section 11. A Shared Responsibility, Securing a Healthier Future for All. The fight against antimicrobial resistance is a shared responsibility. It requires the collective efforts of governments, international organizations, healthcare providers, researchers, and the public. We all have a role to play in preserving the effectiveness of antibiotics. This includes using antibiotics responsibly, practicing good hygiene, and supporting policies that promote antibiotic stewardship. The future of healthcare depends on our ability to address AMR effectively. Failure to do so will have devastating consequences for generations to come. Let us work together to secure a healthier future for all. The time for action is now.